So we are live from almost downtown Boonville, Missouri at Health Without Risk. We're going to start looking at macronutrients. We've been talking about counting calories, that doesn't work. Exercising more, that doesn't work. So we're getting in now to the effects of the different types of macronutrients, specifically carbohydrates, and how it can lead to type 2 diabetes. So we're getting closer and closer to figuring out what makes us gain weight and what makes us get type 2 diabetes over the past 40, what are we at, 45 years. We're at 45 years now. So the first thing we're going to review, hey Sarah, first thing we're going to review is an article from 10 years ago, believe it or not, in Gentleman's Quarterly. You use creamer in your coffee, whether that be milk. Use either half and half, or I use heavy cream. So you might spend a couple of seconds deciding what kind of dairy product you want to put into your coffee. So what's the debate? So the debate is that people think that whole milk and heavy cream is fattening and causes heart disease. Permeated our thinking. Whole milk and whole cream and heavy whipping cream is bad for you. It'll make you fat, it'll hurt your heart, etc. So you have a hard time sometimes. Now remember, this article goes back 10 years, but I remember trying to find in convenience stores, etc. It's hard to find anything other than skim milk or 1% milk. That's changed a little bit. So is what the USDA saying about dairy, whole milk, and cheese. We'll get into yogurt and all that. So what's fattening? Is it true what the USDA has been saying for 45 years? So whole milk has more calories and has more fat. So 1 cup of milk, whole milk, 140 reduce 2.5 grams of fat, and then skim milk or non-fat milk has 83 calories and no fat. Okay, so everybody thinks that 2% milk has 2% of the grams of fat compared to whole milk. Well, that's not true. It has. So when it comes to losing weight, I've taught you that restricting calories just doesn't work, and has poor track record. So numerous scientific studies say that if you starve yourself at lunch, you're going to make up for that at dinner. You're going to compensate and eat more calories. So restricting calories actually overall leads to cutting saturated fat, which we've been told to do since 1977. So low-fat diets and low-calorie diets and the fat-restricted diets are no better than caloric-restricted diets in achieving long-term weight loss. And like I said, as we go through this series, we'll eventually get to what will lead to a long-term weight loss. Okay, American Journal of Medicine, Walt Willett of Harvard School of Public Health wrote, diets high in fat do not appear to be the primary cause of the high prevalence of excess body fat widely, even the release of the incretin hormones and cholecystokinin. So your stomach and your intestines and your gut are telling your hypothalamus that you have achieved satiety, you're full. Fats slow the release of sugar into your bloodstream, and that reduces the amount of sugar that, if not utilized, is going to be stored as fat once it's shuttled to the liver. So in other words, the more fat in your milk, the less fat around your waist. So not only will low-fat milk fail to reduce your waist size, it might even make you fatter than if and they quote is contrary to our hypothesis. Skim and dairy fat, whole milk, and heavy cream was not. So then let's turn to the heart. So is low-fat milk better for your heart? So we've been told to watch our consumption of dairy, whole milk, and high, it's not really cholesterol. There's about at least 4 varieties, and only the smallest and most dense of them are linked with heart disease. So dairy fat, turns out, affects only the large, fluffy kind of LDL, which does nothing to your heart. And then the final thought, bluish white liquid into your the color of many non-fat milks before powdered milk is added to whiten them. So there we are, refining natural substances, and that process, there's been a lot of whitewashing of skim image, meaning it's good for you. So here's the skinny. Is produced by spraying the liquid under heat and high pressure, which oxidizes the cholesterol. You've heard me say that oxidizing lipids creates inflammatory change and damages arterial walls. So in animal studies, oxidized cholesterol triggers biological changes leading to plaque formation in the arteries as well as heart disease. That's from 1996 in Spain. '64 increased total aortic cholesterol plaques, despite having less cholesterol in their blood, compared to rabbits who were fed natural sources of cholesterol. So the question is, what does that do to humans? So let's flip over to some scientific stuff, although that article comments on scientific stuff. And remember, we're talking about this 10 years after that article was written. So this research into what causes obesity, weight gain, and insulin resistance is ongoing. It's changing all. And the high insulin with protein intake. So dairy proteins do have an insulin release effect due to the incretin effect from the fundus of the stomach. But blood sugar does not seem to go up with dairy proteins. So if the insulin is going up if you're drinking milk, does this mean that dairy is fattening? So the answer, of course, is difficult. So protein-containing foods may stimulate insulin partially to the stomach, is that just food can stimulate insulin release, not just carbohydrates. And dietary fats have the lowest effect on insulin secretion. So dietary fats, little insulin release, and of course no sugar, so your blood sugar isn't going up. So by contrast, only carbohydrates have a significant effect on blood effect, but they have a high insulin index score of 90 to 98. So that is dairy products. So that appears to implicate that dairy protein is a major contributor to diabetes and obesity. And there is some evidence to suggest that's true. Big European observational study called EPIC, 38,000 participants followed over 10 years prospectively, and was associated with a So another dietary recommendation is to eat more fish. You're supposed to eat fish 3 times a week, correct? It's got high omega-3 fat content as opposed to omega-6, and we've reversed that ratio the last 30, 40 years. So we're actually eating more omega-6 fats, which are not helpful compared to omega